It's day 2 of India's 21-day lockdown to stop the spread of the novel coronavirus. I'm Suraksha, and over the next few minutes, we will bring you updates regarding the spread of this virus from across India with specific focus on Bengaluru and Karnataka. At the time of recording this video, 695 Covid-19 cases have been recorded in the country. 627 people are active reported carriers of the novel coronavirus in India. 71 have recovered since they were first tested. The death toll has climbed to 17. Kashmir reported its first death today, Karnataka its second, and Gujarat its third. A man in Rajasthan who had tested positive died due to kidney failure. Of all the reported cases in the country, Kerala is still at the top of the tally. The state reported 19 positive cases today and has 126 active cases in the state. Maharashtra has 103 active cases and has lost 4 people to the virus so far. Rajasthan has 46 active cases, Telangana 43, and Gujarat has 40 active cases. 4 new Covid-19 cases have been confirmed in Karnataka today, as well as 1 death. Karnataka has now lost 2 people to the infection. So far, 55 cases have been recorded in the state. For the first time in the state, a patient from Mysuru has tested positive with no travel history or contact with existing Covid-19 patients. He is not a part of any of the existing patient clusters. His only trail of contact is through healthcare professionals, as he was a part of a pharmaceutical company's quality assurance section. However, the Health Commissioner Pankaj Kumar Pandey has denied that it could be a case of community transmission, as the patient might not have remembered everyone he came in contact with. A detailed investigation is under process. 7 of his primary contacts have been traced and are under house quarantine. Remember, community transmission is the third stage of the pandemic, during which the number of cases who test positive for the virus increase exponentially. Among the cases recorded in Karnataka today, the patients are residents of Mysuru, Chikbalapur and Bengaluru. A patient who is a resident of Anantapur in Andhra Pradesh is also being treated here. Apart from the patient from Mysuru who has no travel history, the others have a travel history to Saudi Arabia and France and a local travel history to Himachal Pradesh and Puttaparthi in Andhra Pradesh. For our viewers, patient number 36 from Karnataka had travelled in the S3 coach of the Bengaluru Express from Mumbai on March 17th and arrived in Bhatkal on March 18th. Passengers who travelled in the S3 coach must contact the helpline numbers 080-4684-8600 or 080-666-9200. Or 104 to help with contact tracing. Amid fears that India could see a recession in the coming months, Finance Minister Nirmala Sitharaman announced a financial stimulus package of 1.7 lakh crore rupees for the poor, the farmers and self-help groups to help them battle economic disruption. Most importantly, the package provides a medical insurance cover for those at the front line of the pandemic, such as ASHA workers, sanitation workers, doctors, paramedics, health workers. Each health worker will now be entitled to an insurance cover of 50 lakh. Everyone under the Pradhan Mantri Garib Kalyan Anna Yojana or the food scheme will get 5 kgs of wheat or rice for free in addition to what they are already getting presently. The government will also give 1 kg of pulses to each household under the scheme for the next 3 months. People can take it in 2 installments as well. About 8.3 crore families below the poverty line will get free LPG cylinders for the next 3 months. Senior citizens, widows and differently abled will get one-time ex gratia of 1,000 rupees in the next 3 months in 2 installments. This will apply to 3 crore individuals. Women who hold Jan Dhan accounts will get an ex gratia payment of 500 rupees per month for the next 3 months. Wages under the Mahatma Gandhi National Rural Employment Guarantee Act have been increased from 182 rupees to 202 rupees or 20 rupees per worker per day. This will apply to 5 crore families. Women self-help groups will get a loan of 20 lakh and this will be collateral free. Until now, they were entitled to a 10 lakh loan which was collateral free. About 8.6 crore farmers will get 2,000 rupees in their bank account in the first week of April through direct benefit transfer. As we reported earlier, states have been asked to utilize 31,000 crore rupees in the central government fund for construction workers to take care of their daily needs. For the organized sector, the EPFO scheme has been amended so that workers from the organized sector can draw up to 75% non-refundable advance from credit in their PF account for up to 3 months' wages, depending on which is lower, in order to meet emergency requirements. However, both these clauses will apply to those institutions that have up to 100 employees, out of whom 90% must draw wages of less than 15,000 rupees. The Director General of Civil Aviation has extended the ban on flights landing in India until April 14th. The earlier ban was until March 31st. The ban applies only to commercial passenger airlines but not to cargo flights. After the Prime Minister appealed to Indian citizens to take care of 9 families in the next 21 days, donations have started to come in from Indian corporates and actors. Telangana saw a flood of donations as several companies have made donations ranging from 1 crore to 5 crore rupees to the Chief Minister's Relief Fund. Actors Pawan Kalyan and Mahesh Babu have also contributed 2 crores and 1 crore respectively. The Bajaj Group has committed 100 crore rupees for the fight against Covid-19. Wistron India, a maker of smartphones for Apple, has donated 1,000 units of face masks to Bengaluru Police. In Karnataka, Chief Minister B.S. Yadurappa has appealed to people to help the state government by donating money for advanced medical support systems to fight the spread of Covid-19. Those willing to donate can transfer funds online and also send checks or DDs to Chief Minister Relief Fund COVID-19, SBI Vidhan Sauda branch. In Karnataka, SSLC exams which have been postponed will be held only after April 20th. Around 1.28 lakh doctors registered with the Karnataka Medical Council have been authorized to practice telemedicine for minor ailments in the state during the lockdown. Registered medical practitioners would be allowed to prescribe medication online if the patient's medical history is known to the said doctor and if it is a minor ailment. If the medication does not involve injectables and if it isn't a suspected COVID-19 case, the prescription can be given in a PDF file on the doctor's letterhead. The Karnataka government has warned strict penal action against landlords or house owners for forcing doctors, paramedical staff and healthcare professionals to vacate their rented residences, citing COVID-19 spread through them as the reason. Additional Chief Secretary of the Health and Family Welfare Department, Javed Akhtar, said such behaviour amounted to obstructing public servants from discharging their duties. Meanwhile, Bengaluru Police Commissioner took to Twitter to announce strict action against PGs which were forcing their inmates to leave. Moving on to Bengaluru, the lockdown has had an unprecedented effect on some of its busiest market spaces. A normally packed Avenue Road was deserted and police stood by to cordon off areas. KR Market, the hub of wholesale fruit and vegetables, was also empty. Vendors who otherwise see brisk business have been left to fend for themselves. Meanwhile, supermarkets are marking out spots to make sure people who are queuing up stay away from each other. Essential services like the Indira canteen stay closed as the Chief Minister reversed his decision to provide free food at the canteen to the needy. On the other hand, BMTC has started a special bus service to provide transport to vendors of essential goods. The Bengaluru Police Commissioner has been meeting with several representatives of essential service providers to find a solution to those who need to be on the roads to provide these services. A pass system is part of the solutions being explored and people have been lining up to collect these. The Home Quarantine Enforcement Squad has quarantined 42 people yesterday based on the complaints received. To report home quarantine violations, contact 9154153916. Before we go, there has been a scare that handling a newspaper could contribute to the spread of the virus. However, experts disagree, and to know more, you could click on the link in the description to read what they have to say. Print media has been categorized as an essential service, and we spoke to Medical Education Minister Dr. K. Sudhakar earlier today to know what he has to say.
Daily newspapers are all very essential things that we have to understand. Every day it is very important for us to read the newspapers. So please do not disturb that network. So I appeal to everybody not to spread the rumors about newspapers.
So try and get hold of your copy of the Deccan Herald for in-depth reporting of the COVID-19 crisis. For those outside Karnataka, log on to deccanherald.com for the latest updates. Stay safe, stay indoors, and we'll see you tomorrow.